Hello, this is Dr. Mary Manis. We're talking about informed consent and autonomy. Today's presentation objectives are to identify requirements for informed consent and identify ethical foundations for informed consent. Informed consent is based on the ethical principle of autonomy, that patients have the right to make an independent determination about what may be done to their bodies. It requires physicians to provide pertinent and understandable information to patients about proposed treatments or procedures and their associated potential benefits and risks. What is required for informed consent? Physician elicits and documents informed consent prior to providing treatment. The patient is at age of majority and of sound mind. Capacity refers to sound mind and is a legal determination. What is required for physicians to disclose to patients for informed consent? The condition being treated, the medical problem or disease for which patient requests care, all diagnostic tests that may rule out a possible condition, as well as the nature and character of the proposed treatment or surgical procedure. That could be medication, therapy, or other treatment or surgery that physician recommends for medical problem or disease. What is required for physicians to disclose to patients for informed consent? Further anticipated results. What effect treatment will most likely have on medical problem or condition? Recognize possible alternative forms of treatment. What else might be used to treat the condition, but is not the physician's strongest recommendation, including non-treatment? What else is required for physicians to disclose to patients for informed consent? Any recognized, serious, possible inherent risks, complications, and anticipated benefits involved in the treatment or surgical procedure, as well as in the recognized possible alternative forms of treatment, including non-treatment. This needs to be individualized, significant to a particular patient. There are exceptions to physicians being required to elicit and document informed consent prior to treating. The patient is unconscious or otherwise acutely incapable of consenting, and the benefit of treating the patient outweighs any potential harm of the treatment, and the physician must obtain informed consent as soon as medically possible. There's another exception to physicians being required to elicit and document informed consent prior to treating. Disclosing medical information would pose a threat to the patient. This cannot be used to withhold information merely because the information may cause the patient to refuse, though. So, best practices in informed consent. Inform the patient thoroughly about proposed treatment options, and this is key, verify that patients understand their choices. The explanation, the information, the discussion has to be in words, vocabulary, language that the patient completely understands, and understanding has to be verified. The physician must secure and then document patient consent. Typically, this occurs in the matter of surgical procedures with witnesses. Physician also must disclose any personal or economic interest that may influence physician judgment. If physicians own any part of, say, a surgical center, that needs to be thoroughly discussed or at least disclosed to the patient. And finally, disclose information that a reasonable person in the patient's position would find important, and that could be including physician's level of experience. So, informed consent and autonomy. Physicians support patients' autonomy when adequately obtaining informed consent. Always provide pertinent information in patient-friendly ways. Always verify that patients understand all information required and requested. Always document consent in a legal manner. Informed consent and autonomy are associated with professionalism and ethics. Proper informed consent requires physicians to demonstrate respect, compassion, probity, honesty, and trustworthiness in their communications. Requires physicians to address issues of culture and also at times religion, age, gender, sexual orientation, and mental and physical disabilities, as these can affect recommendations for treatment. These can affect patients' decision to accept treatment. Physicians utilize lifelong learning skills to provide accurate information about treatment options when providing informed consent. So physicians commit to ethical principles of autonomy as well as non-maleficence, fidelity, justice, beneficence, and utility when obtaining informed consent. Thank you.